Hi everyone, this is Counseling 2500, Chapter 17, Marriage, Couples, and Family Counseling. Alright, so let's just get into this. Family therapy uses behavior therapy, cognitive behavior therapy, and Gestalt therapy, according to this textbook. Although obviously you can use other ones as well. And these are typically created as individual focused therapies, which basically means usually you would work one-on-one with someone, but it has been, basically adjusted. Uh, so for couples, marriage, and families, the focus is more about the interpersonal systems. So interpersonal, just to remind you what that means, is relationships, how people communicate with other people, how effective or how ineffective they are. And just a note, just because I don't know if you all know what nuclear family means, but that just basically means just like, parents and the children, okay? Uh, what's not a nuclear would be grandparents, uncles, aunts, cousins, and all those things added into it. Then they would not necessarily be considered a nuclear family. A nuclear family is like a typical family, which is usually two parents and, kids. All right, so all of this is all about systems theory. Systems basically means like a group of things working together, right? Like a system, like let's say your TV has a speaker, it has a TV, it has a remote control, it has a, I don't know, do you guys have a DVD player or whatever? That becomes a whole system of things that are connected to each other, right? So therapists see families very much like that. So they're called systems theory. So family therapy is a psychotherapeutic approach that focuses on altering interactions between a couple within a nuclear family or extended family, between a family and other interpersonal systems, with the goal of alleviating problems initially presented by the individual family members, family subsystems, and family as a whole, or other referral source. So what that is basically talking about is, basically the relationship between the family members or the people around them in their environment, right? And usually when we talk about uh, marriage, family counseling, and stuff like that, it really is talking about relationships within the family. There are 5 foundational schools of couple and family counseling or systems theory. The first one is called strategic. The second is called structural. Third is transgenerational. Fourth is symbolic experiential. And 5 is conjoint. So these will all be explained in a couple of slides from now. Okay, just want to let you know that these are the ones that we'll be focusing on in this chapter. So let's talk a little bit about the historical roots of family, marriage, couples counseling. It started off in the 1950s, and this group of people, Nathan Ackerman, Theodore Lidz, Lyman Wynn, Murray Bowen, and Carl Whitaker, are really well-known psychologists during this time period. And they were all trained as psychodynamic therapists or psychodynamic model, which is very Freudian. Remember Freudian? Freudian means basically that the things that happen to you when you were a child affect you for the rest of your lives and actually make you who you are as you're older, right? So this group of people, although they did study under him or under Freudian style, they believed dysfunctional behaviors was rooted in the individual's past and present family life. So it wasn't just what happened when you were younger, but the relationships that you develop as you're older, let's say your spouse, your children, and stuff like that, that also affects if there's going to be things that might be unhealthy in the relationship and causing, let's say, unhappiness. So Ackerman wrote a book called The Psychodynamics of Family Life. And basically the book explored the interrelated themes. Interrelated basically means they're all connected. So like what are the themes that are connected to each other? And these are the ones that he noted. The interdependence of individual and family stability at every stage of growth from infancy to old age. The role of family in the emotional development of a child. The family as a stabilizer of the mental health of the adult. The family as conveyor belt for anxiety and conflict and as a carrier of contagion of mental illness. The interplay of conflict between family and community. The conflict in family relationships. The conflict within individual family members. And the breakdown in adaptation and illness as symptoms of the group pathology of the family. So I know all of it sounds kind of, intense, but if you read it, it kind of makes sense, right? Some of the stuff is just about the relationship between the family members and how that can cause people to be unhappy, right? Or the fact that as we get older, our relationships change with our family member. So let's say that you are 5 years old, your parents probably were helping you a lot, right? But when you were 45 years old, I don't think your parents were helping you as much, right? They're like, well, you're an adult, you can do the things that you need to do. So that's what it's talking about, is the fact that even as you get older, the relationships have to change because they're not the same, right? But we can also explore how sometimes families keep their children with disabilities as though they're children for the rest of their lives, but they're not, right? So a lot of this stuff is really basic. And I want you guys to just read through this if it was a lot for me to read and for you to understand. But if you read it, it really does make a lot of sense and it's kind of obvious and it's logical. All right, so now let's actually talk about those 5 foundational schools of couple and family counseling that we had brought up a little bit earlier. The first one is called strategic, and it focuses on eliminating problems and changing dysfunctional patterns. The history of this type is from the 1950s, studying the communication styles of people with schizophrenia. Okay. There was also conjoint, which is to aim to promote positive communication styles within the family. And how did that happen? That was because of Virginia Satir, who used the Mental Research Institute, or MRI, elements within a framework of Gestalt and experiential therapy. So this is how it was created. And we're just giving you kind of like a quick little taste of this. And as you start to focus more on marriage family therapy, let's say in your graduate work, you'll start to understand this even more and get more information about each. But as of now, we want to kind of give you a taste of it so you understand what the focus is when it comes to family therapy as opposed to individual therapy. The next one is structural, concentrates on intervening with dysfunctional power structures and hierarchies in the family. And that came from Salvador Minuchin and his team studying families of delinquent boys and also families with a member who had psychosomatic disorder. Psychosomatic, like, remember, I don't know if you remember, but let's explain it again, which is basically when you feel sad or you feel upset, it turns into a physical, like a stomach ache or a migraine or a headache or an ulcer or something like that, or high blood pressure. So it's something that's mental, right? Something that causes you stress, let's say work or your relationships. And then because of that stress, it turns itself into something physical, like a stomach ache or whatever it is. And that's what he studied, or they studied. Then there was transgenerational, seeks to help clients differentiate their self within their family system and understand their family of origin. And the history behind that is Murray Bowen and his team focused on families with a member with schizophrenia. He had the families move into the hospital so that he could observe their interactions. So you can sort of see, like, inviting, let's say that the daughter had schizophrenia, but the parents moved in and lived with them, right? And so that the doctors could actually observe everything and see how families react when they have a child with a schizophrenia or whatever. And then the last one is called symbolic experiential, is to improve psychological functioning by intervening on family symbol making. So what it means by family symbol making is how relationships are so that it establishes that as a rule, right? So let's say, for example, a kid, the son, is bullying his parents, right? But we might see that the father will fight back, okay? And so we want to see how that is, because one is kind of like the father may be trying to establish dominance in the family, right? But we see the kid is also trying to establish dominance as well. So that would be a symbol within the relationship. I hope that makes sense. And the history behind this is Carl Whitaker and his team brought families into treatment with his patients. So it's similar to the other one that we talked about before, where let's say that they live in a facility, the parents also live there as well, so that they can also see how the family is reacting to the patients. Okay, now let's talk a little bit about contextual dimensions. So context, again, remember, kind of means like the environment. What's going on? What's the situation, right? So maybe, let's say you see 2 people yelling, right? What is the context? Because if they were acting, then you're like, okay, well, they're yelling, but they're acting. But what if it is one person had killed another person's family member and they're confronting them and they're arguing. The context of that is really different, right? So that's what context means. It's like the situation or the environment that this thing is in helps us understand what's going on. Counselors who work with families do not work in a vacuum. And when you hear the word vacuum, that basically means like a space with nothing, right? Instead, really, when you work with a client, there's so many things that are in there already, right? Within that family or that person's life already. Their family, their schooling, their work. So it's not a vacuum. It's not an empty void. So instead, there is an overlapping of cultural and professional contexts or environments or situations. So the four that they talk about in the book is, number one is cultural competence imperative. Imperative basically means really important or really crucial. Efficacy imperative. The third is professional nomenclature. Nomenclature means like terminology or the way that things are named, right? About couple and family counseling. And the fourth one is professional practice patterns of couples and family counselors. So that's more about the counselors and how they act, okay? So we're gonna actually now go in and explain each of these in more detail. All right, so cultural competence imperative. The International Association of Marriage and Family Counselors Ethical Code highlights the need for couple and family counselors to practice in a culturally competent manner. So again, this is not new, right? We're talking about being culturally competent. That means understanding diversity, at least studying it so that you're aware of it, and then hopefully you'll expose yourself to it and learn even more. Professionals know their perspective, influence, and conceptualization of problems, identification of clients, and implementation of possible solutions. So the more diverse understanding you have of culture and all that stuff, the more you're able to pull in ideas on how to help this family. Okay. Professional examine personal biases and values. So that's from yourself. It's like when you see, let's say, a Black family, what do you think? When you see a Latinx family, what do you think? When you see an Asian family, what do you think? When you see a Native American family, what do you think? And when you see a white family, what do you think? Or a biracial, what are your automatic assumptions? And you need to recognize that those things are not necessarily true, but because we were taught these things when we were younger or influenced by other people, we want to go, oh, wait a minute, that's something that I'm putting in that doesn't naturally exist in this situation. So let me put this to the side so that I don't put my own values onto this couple or this family. Okay. Actively attempt to understand and serve couples and families from diverse cultural backgrounds, more than the ability to repeat checklists of generalized norms for particular cultures. So what that basically means is, I know that you guys are going to learn about multiculturalism. I think it's Counseling 2250. And what we do is we introduce you to the different cultures, but we also don't want you to generalize that all families of that culture are like that, okay? And that you appreciate and understand that some of them might not be religious at all, even though maybe the majority of them are religious. The couple that you work with are not religious. So those are things that you need to realize and always keep in mind, okay? That you don't make these assumptions about a generalized culture. The reason why is because the model that you are taught about multiculturalism is really difficult. How do we teach about every culture? It's really hard. So instead, we find people who show us commonalities within religion or culture or whatever it is, and we talk about it in generalized terms. But we always say, to the side, like a little side note is, not every family is like this. This is just something that you want to keep in mind. Okay? Therapists must be aware of their own assumptions about a client's cultural narratives. All right, the efficacy imperative. The International Association of Marriage and Family Counselors Ethical Code mandates the use of effective interventions. So what that means is you should use techniques and interventions that have been proven to be effective. How? Through research. So there are two types. There's outcome research, which is defined as research that examines whether an intervention works. So you'll see journal articles where they say, we attempt to do it this way, and this is what happened. So we're saying that it is effective or not effective, whatever it is, it may be in that journal article. There's also a thing called meta-analysis. And that is research technique by which multiple individual studies can be grouped together to empirically analyze the overall effectiveness of a particular intervention approach. So let's say that Dr. Siu did an article or journal research article about person-centered and marriage family therapy, right? And then let's say Dr. Broadwin also did one too. And then let's say Professor Haga did one, and Professor Richard did one, Professor Ga did one, and Professor Kier did one. So we have a lot of individual research. So what a meta-analysis does is, because they're similar topics, they're going to put them all together and see what are the commonalities of the research. And that would be what a meta-analysis is, to combine a lot of things that are similar in focus to see what the bigger picture says about it, right? So here's an example. Hazel Ray Cooper and Bourdain in 1987, the first meta-analysis of couple and family counseling outcome research. And what did they find? They found that couple and family counseling had a positive effect on clients when compared to either no treatment or an alternative treatment. So what that is saying is that they collected a bunch of studies that have been done already, and they said that couples, let's say, who go into marriage family therapy benefit from it if you compare to people who don't have any therapy at all or another type of therapy. And some of you guys might say something like, duh, like that makes sense, right? Well, but the thing is, this is research, so we want to show proof of it. We can't just automatically assume and go, duh, that totally makes sense. No, we want to see actual proof. And this is how science and psychology, amongst the other related fields, shows that something actually works, is to show proof. You can't just say this and then, we don't, and just assume that everyone would agree with you. So an example, let's say, would be exercise. If you exercise, you probably burn calories, right? How do we know you burn calories? It's because someone measured the calories that are burned. If you just automatically say something, people might say, oh yeah, that sounds logical, I'll agree. But there's no proof in it, then it actually might be false. Okay, so we need to see proof. And this is what meta-analysis or outcome research is all about, is to find the proof so that we can move along and not question those things. Outcome research also found that effectiveness of family and couple counseling with substance abuse, relationship discord basically just means sadness or upset or distress, schizophrenia, anxiety, grief, and depression. There's a thing called brief strategic family therapy, and that was really successful with Latinx, Black, and Asian families. And then we talk about nomenclature. Nomenclature is just a fancy word for terminology or the way we name things, okay? So the argument here is couples and family therapy a professional specialization or a distinct profession? So should it actually be part of, let's say, counseling, or should it actually be its own thing? Right? So the people who practice family and couple counseling are people who are also psychiatrists, who are nurses, psychologists, counselors, and social workers. So they all use it, right? But people who are marriage family therapists or MFTs only practice couple and family therapy. So is it one or the other? Right now, the answer is it's both. There is no decision yet. So the terminology is a little still, indecisive as of now. And if you're an MFT, you might say, well, you know what? We really just are a separate group, right? But the thing is, all those other things we talked about, nursing, psychology, counseling, social work, usually deals with the family too, right? So again, can we really say it is separate? So nomenclature can be controversial, can be discussed. And now let's talk about professional practice. So there was a study of MFTs, or marriage family therapists, and they found out these things. 24 clients in their active caseload, so that means that they see about 24 clients regularly. 20 client contact hours per week, so that's how many times they meet with their clients. Problems that they deal with or they work with is depression, marital problems, anxiety, parent-child problems, and adjustment disorders. The median number of sessions per client was 12. So maybe if you do it once a week, that's like 3 months or so ish, right? 50% of the treatment provided by the sample of individual counseling. So what that means is actually half of the time they're actually meeting one-on-one with them, even though it might be dealing with the family. So that's kind of interesting as well. It's not always family, 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 although they might meet with an individual. They might be talking about the family systems, the family dynamic. All right, when it comes to actual application, which is why it's really interesting, is the stages of the interview. Okay, there's a pre-session planning, which means before you actually have sessions. 2 is joining. 3 is problem statement. 4 is interaction. 5 is in-session conference. And 6 is goal setting. And we're going to go through each of these in the next couple of slides. Okay, so the first is the pre-session planning. So the therapist should determine in advance who will attend the session. Is it the mom and the dad and the son, let's say, or is it just the mom and the son, or the dad and the son? What is it? Have a general idea of the nature of the present problems. And then, of course, pre-session telephone calls or an intake form is usually how it will help you decide what's going to happen in this therapeutic relationship. Okay, the next part is to join or joining. Most important task of the initial interview is to join with the family. So that means becoming part of the family. And it's going to be really interesting. So you're accommodating for effective tone, which basically means through mimesis, which is to join the family and become like family members in the manner of content of their communication. This is not a parody and do not cross any lines. Okay, so when you see a family talking, you kind of mimic them or act like them so that you become part of that family. Okay, interesting, right? There's also the tempo. The tempo is kind of like the speed or the tracking of it, which is often you'll use Carl Rogers, right? Or reflection of content. So you might say something like, what you're saying is really showing me that you're really upset, right? So that you're reflecting what they're saying and asking for clarification. And that means, if you have questions about what's going on, that's when you ask. And at this point, avoid comments or interpretation. So you don't know the family well enough yet, right? You're getting to know them. So you're not going to ask that many, you're not going to try to interpret anything just yet because you're trying to still understand what's going on. Then there's language, seeing the family structure and acting in a way as to be included within it. If dad acts as a central switchboard in this family, which basically means if the dad is in charge, the therapist accommodates to that and contacts other members through him. Okay. The next one is family structure, using family chronologies and genograms to really understand the family. So chronologies is just basically kind of like a date, so you understand what happened when, like when did the parents meet, when did the parents get married, when did the parents have kids, all that other stuff is the chronology of it. But also the genogram. A genogram is like a family tree, right? So we might have like grandparents on the top, and then the parents, and then the parents' siblings, and then the children, and the grandchildren, and so forth and so on. And that will also help you understand as well, because you'll see how certain people connect, some people talk, some people don't talk to each other, and all those things will help when you see like a family tree or a genogram. So now let's go into the problem statement. So here are some things that the therapists in the book have recommended. The adult who seems less involved with the problem be spoken to first. And also, the person with the most power to bring the family back be treated with the most concern and respect. It is unwise to begin with the identified patient or the main patient, right? You don't want to start off with them immediately. And you do not want to force someone who's not really talking to speak. Instead, you might want to ask another family member, what would Johnny say if he chose to talk? And after several times, the quiet person may want to speak up and defend himself or herself or themselves. Okay. There are several ways to state the problem question as well. And this is just typical, like in any type of counseling. What brings you here today? Or what is the problem for which you are seeking help? Or if it's very future focused, when this therapy is successful, how will your family be different? And it's also kind of known as the magical question, which is, if you woke up tomorrow and all your problems are gone, what would an amazing life be like to you? Describe that. Okay. And then that can show us like a goal of where they want to go as a family or as an individual. The next one is called interaction. By this time, you will probably have realized that the family is not in agreement regarding the nature of the problem. And that's very true, right? The mom might say, this is the real problem. The father might say, this is the real problem. And the child might say, this is the real problem. So you're going to see some disagreement in that area. The therapist's focus will be on determining the patterns of interaction that sustain the problem. So the way that they talk to each other is how this unhappiness is continuing, right? So you as a therapist are going to observe those things and see whether or not there are patterns. Okay. The therapist can encourage the family to discuss the differences and try to reach an agreement. The therapist steps back but does not leave to let the family talk to each other. Becomes the director of the family drama. Or introducing a third party when two seem to reach an impasse, which basically means if the couple can't agree on anything at all, we might bring in another person, maybe a friend, two friends, like let's say a friend on each side, a family member, someone else that will come into the situation and maybe help clarify what's going on. And of course, asking family members to change their seating patterns to facilitate new encounters. So let's say that the wife sits on the left, the child sits in the middle, and the husband sits on the right, right? Instead of that, we might have it so that the husband and the wife sitting next to each other and the child sitting onto one side, right? We want to switch it up so that we see how people will react to that type of thing. And then once an agreement is decided, now what you want to do is have them perform the problems. That means acting it out, which means standing up and actually doing the things, okay? So the example here is when Johnny doesn't take out the garbage, what happens? Who is first to notice, show me how this all works, okay? So if you love acting out, this will be a great activity, right? However, if some families are not able to move like this, have a pre-planned scenario. So that means basically you're gonna have one set of scenarios that you actually want them to do if they are shy to do their own. Okay, and what you can do is you can start off with when the alarm goes off in the morning and then proceed to have them act out the day. Okay, so you're forcing them to get up and physically move around so that you can see how they interact with each other. And the purpose of this is to determine the family hierarchy, so who's in charge, to reveal any stable coalitions, which basically means does the sister and the brother really depend on each other for support? 3, to locate, diffuse, or rigid boundaries between family subsystems. Are there certain people that the family members avoid at all times, or whatever rules or whatever people they avoid? We want to see that. And to reveal the chronically repeating interactional sequence that sustains the problem behavior. So chronically, again, means long lasting, right? So what are some of those behaviors that are actually making the family unhappy? You'll start to notice those things. They'll start to emerge as you're observing. The next is the in-session conference. Some therapists will work with an observation team. The therapist may be too distracted with the interactions to see the patterns. So you actually might have one of those one-way mirrors, like in a movie, like the show SVU, where people are observing, but they're hidden because the mirror doesn't show one way. And then you can consult them and talk to them about what they observe. Because if you're part of the family while you're interacting, you might not necessarily get to see all of it, right? Unless you record it or something like that. So assess the accuracy of the presenting hypothesis and create the correct homework to help change those behaviors. And don't overthink the homework assignments. Instead, use your hunches to create homework that will make the clients think over the entire week so that they're processing the therapy that they're going into, right? If you make them just do something right then and there and then they forget about for the rest of the week, it might not be very helpful because they're not, let's say, involved or mindful of what's going on. And then there's goal setting, which is reaching an agreement with the family on a solvable problem. And you want to state it in behavioral terms, which basically means things that you can actually see and do, right? So you want to avoid vague statements. Vague means unclear, okay? These are some examples of that. Improve communication. That really means nothing. That just means talk more, but who, right? So we want to say something like, let's say, mom will communicate more with the child every day in the mornings and then also at night or something like that, right? Or raise self-esteem. Ugh, that is so vague. Like, I have no idea what that means. And then also make the family more cohesive, which basically means make the family more together. What does that mean? Does it mean interacting with each other through play or, spending a movie night with the whole family? What is it? You want to be much more specific with the behaviors. And in terms of family and couples counseling, 50 minutes is usually not enough. So that's definitely something that you want to think about when you guys are scheduling your appointments. It might need to be an hour and a half, 2 hours. It really does depend on the situation. But just to be aware, 50 minutes goes by really, really fast. Okay, now we're going to move into more applied stuff that you should be learning when it comes to marriage, family, and couples counseling. The first thing is circular questioning. So questions intended to uncover the complementarity of family relationships that make the presenting symptom necessary for family homeostasis. So that's just a fancy way of saying is, how do you talk or ask questions to your clients to understand what makes them stable? That's what homeostasis is balance. Okay, so family relationships, you might ask a question such as, tell us how you see the relationship between your sister and your mother. Okay, so instead of asking the sister and the mother how the relationship is, you're asking another person to now talk about them, right? About the relationship between the sister and the mother, what your perspective is as another member of the family. Interactive behaviors would be, when your father gets mad at Bill, what does your mother do? The differences in behaviors is, who gets most upset when Jimmy wets the bed, your father or your mother? A ranking family question would be, who is the closest to your grandmother? Then who's next? And then who's after that? Change before and after an event. Did you and your sister fight more or less before your mother remarried? And hypothetical circumstance. Hypothetical basically means kind of like a make-believe, like a just in case, like if this happens, how would you react? So if one of you kids should have stayed home, not get married, who would be best for your mother and your father? Okay, so you want to also note, even though you might think these questions are amazing or the style is really great, some therapists are against circular questioning because it is seen as gossiping or mind reading, right? And mind reading is not necessarily always correct. Advocates for circular questioning say that when you ask more personal questions, the answers that you get from the family may be very different than in individual therapy. And that's also very true as well. So the example there, right there is, let's say that you're talking to the daughter one-on-one, and she'll tell you what she thinks the problem is. But if she's really afraid of her father and you're doing a group thing and you ask, she might lie or she might downplay things, right? So that's not necessarily accurate either. So you can see how academics, psychologists who are experienced can argue both ways. So we want you to know that so you can also make that decision yourself. Now we're going to talk about reframing a problem. And reframing basically just means putting the problem into a different perspective. Okay? So when the problem the family presents is not easily solvable, there are different ways that you can do that. So operationalizing is casting the problem in observable behavioral terms. So instead of a child that is driving us crazy, which doesn't really mean anything, to reword it to specifying the specific behaviors that are problematic. So maybe it is the child is, let's say, wetting the bed all the time. Okay, so that might be what someone might say is driving us crazy because they have to do the laundry all the time or something. So instead, we want to say wetting the bed. Okay, not is your behavior is just driving us crazy, because that doesn't really mean anything. We don't really know what that means. So, and then you might want to encourage the family members to keep a frequency chart of the behaviors so that they can actually track it so they feel like they're working on the problem, right? There's also emphasizing complementarity, which is describing the problem in an interactional context. So that interaction means, interactive, right? Like there's an action between you and me. So instead of saying a depressed father, you might want to say, who makes father depressed? So we know who it is, okay? Instead of just saying he's depressed. It's what is making him depressed? Who is making him depressed would be a much more clear way of communicating that. Denominalizing is removing a reified. A reified basically means like a real diagnostic label and replacing it with a behavior that can be consciously controlled. So, sometimes a label or a name of an issue is really confusing or it doesn't really mean anything to the everyday person. Okay, so let's say that the client has anorexia. Okay, a lot of parents might not know what anorexia is, right? But when you say something like a girl who refuses to eat, then people will understand it. So you're reframing it from that label, so it's into something that anyone can understand. Okay, again, behavior focused, right? There's also positive connotation, describing the symptomatic behavior as positively motivated. So an example is a defiant and delinquent boy is described as sensitive to family conflict, and he's sacrificing himself to keep the parents from divorce. So you can sort of see how that's more of a positive spin on it, right? You could have said the child is acting crazy and trying to tear up the family. But actually you can see it a different way, which is the child is causing all of this so that the parents talk to each other, because that's how the child thinks they're going to keep the parents from divorcing. Does that make sense? Isn't it interesting? Okay, now we're talking about giving directives. Okay, creating or selecting an intervention that will attack the hypothesis basis on the presenting problem. So there are two types. There's compliance-oriented and defiance-oriented. And we're actually going to explore each of these in detail in the next couple of slides. So compliance-oriented. So here are examples when it comes to caring days. Ask both members of a hostile couple to act as if they care for each other by daily performing 5 minor behaviors requested by their spouse. Okay, so caring days. Days where I care about my partner, right? And so you might have a list, each person, and then the partner will do those things or try to do those things through a specific day or throughout the week. Okay, role reversal. Ask a disengaged husband to give his enmeshed wife a vacation from responsibility for the children. He is to be responsible for the meting out of discipline. Meting out means basically carrying out the discipline. She may consult with him, but is not to be in charge. So role reversal. So before, the wife might have been the one in charge of the family and all that stuff. Now let's let the husband do it instead. So that might be really good, because then the husband might go, oh, I didn't realize how difficult it is to raise children, or something like that. And then they might be more communicative with each other. Or maybe the husband will say, I don't know what to do. I don't know what to do. Honey, help me with this. And then they actually start to talk a little bit more, right? Isn't that interesting? All right, safe practice. Ask a man who is afraid of job interviews to apply for jobs that he would not take if they were offered. So basically, is if he's afraid of interviewing with people, make him go to interviews where he knows he's going to get that job, right? But he's not going to want it, because when you do that more often, practice will make you a little bit more familiar and less uncomfortable. Okay? Surprise. Ask a couple who are hostile and out of touch with each other to plan a surprise that will please the other, but would be so out of character that the other could never guess what it would be. Each should attempt to guess what the other will do, making a written record of his or her guesses. So here again, it's like, doing something that's out of the blue, but kind and loving. Okay. And then that might spark some love with each other again. Let's hope. There's also symptom prescription. Asking a single mother with 2 boys who are disrespectful to their mother and constantly fighting to hold a daily wrestling match where she is the referee and will enforce fair fighting. The boys are to agree to reserve their fighting to these bouts. The mother is to insist on the bouts even if the boys are unwilling. So it's kind of like, again, almost a reversal, right? But we're just going to say, this is what we want you to do now, right? So if the kids are fighting all the time, now we're going to say, you're going to fight while the mom is there to tell you who is going to win and all that other stuff. What are the rules are? They, no, you can't do that, and stuff like that. Because that actually facilitates communication and also limits the fighting, maybe into certain prescribed times, which is kind of smart. Then there are defiance-oriented directives. And there is a note for this part right here. Before trying out these things that we're going to discuss here, you should be more experienced at family and couples therapy before you do these things. And the reason is it might get out of control. And if it is, you need to understand what's going to happen. So you need more experience to be able to control something that might go out a little bit more crazy or something like that. Okay, because the other ones were kind of safe, right? These ones are, it's interesting, it's provocative, but we also don't know where it's going to go. So if you're trained, then you know how to handle difficult situations. If you're not, you want to start thinking about how to handle these things so that when you are ready finally or have more experience, you can then do these things. So the first one is called positive connotations, which is reframing the problem behavior in positive terms and indicate that it would be dangerous for the family to change. So even though the behavior is bad, we're going to say, well, maybe this is the reason why it should exist, right? So it's kind of like reverse psychology kind of, right? Where we're going to say, actually, this is good that this is happening because this is the result that you guys want, right? And so it's kind of like playing kind of like a mind trick in that sense, right? So you're reframing, again, showing it from a different perspective. And again, so you might not know how to react if the thing goes awry or wrong. So you do need to be more experienced when you do this, okay? There's also symptom increase, which is recommending that the problem behavior be increased in order to get a better understanding of it. So this is kind of like exaggerating, okay? So let's say that the kid is throwing tantrums. Now you want the kid to throw more tantrums, okay? And when you do that, people start to maybe feel a little silly about what's going on, or they get tired of it, right? And they actually might stop. So it's very similar to a thing called aversion therapy, where let's say, for example, you want to quit smoking, right? So instead, you're going to make the client smoke like 10 cigarettes at once, like load it up, right? Until they get sick. And then maybe they don't want to do it anymore because they're so sick of it, right? So it's very similar to that, where it's symptom increase. Again, we're reframing the situation. There's also restraining. Recommend that the family slow down in an attempt to solve the problem. So instead of actually trying to fix it on time, we're just gonna slow it down a little bit, okay, so that they can really think about that stuff. Then there is symptom retention. Advise the family to retain a certain percentage of the problem in order to remember how awful it was. So instead of pretending like it's not going to happen anymore, we're going to keep it there so that everyone goes, okay, we get the point. This is awful, the way that we are treating each other and all that stuff. So that reminds them, and then hopefully in the future it will actually change. There's also prediction, which is predict relapse of a symptom that has been brought under control. So this is also kind of, it sounds kind of evil, right? Where you're basically like, oh, I think you might come back again. You're not gonna be able to maintain this. And then by doing that, they're gonna go, oh yeah, we're going to maintain it. And then they actually might keep on doing that thing continuously, right? So do you see how this needs to be more advanced experiences before you actually do it as a new beginner, right? But I want you guys to think about these more complex, more advanced techniques because they're really interesting. Okay, now we're going to talk about assessment, which is basically kind of like observing the family and seeing what's going on and understanding it that way. So there are 6 different ones. It is number 1, family dysfunction, 2, family developmental tasks, 3, family fusion, 4, dysfunctional behavioral sequences, 5, hierarchy problems, 6, communication problems. And we're going to now explain all of these in the next couple of slides. All right, family dysfunction. Rather than focusing on the internal state of the individual, the family systems approach looks for pathology in the interactions that occur between people who have significance for each other. So what that is just basically paying attention to the actions that they treat, how they treat each other, and then calling that the problem, and then trying to help resolve those things. And then hopefully that will make everyone feel better inside as well. Again, we're talking about families instead of the individual, right? Although obviously everyone is going to individually be affected. Then there is family developmental tasks. Successful movement to the next development stage requires changes in the roles and structure of the family. Denying the need for change, treating a normal developmental change as if it were a problem, and striving for perfection are likely to result in distress. So this is like, when sometimes parents don't want to admit that the fact that their children are growing up, okay? And they might treat their child like a little kid when their kid is 18, 20 years old, right? Or 40 years old. So here's an example. A girl becomes a teenager and exerts more autonomy, which basically means she wants to do things on her own. Parents become concerned for her safety and morality, so they're doing it out of love, right? So they increase their control over her behavior. And then the girl resents their attempt to control her autonomy and rebels. Then the parents increase their control and the cycle repeats over and over again. And you can see how the problems will start to blow up. The kid will say, you're not the boss of me, and stuff like that, right, during this time period. And so we need to understand, parents need to understand, as children grow older, they're going to want to have more freedom to be able to make decisions. But you also want the parents to be able to be open enough that the kids will talk to them when there are problems, because parents do have a lot of wisdom, right? Even as much as we want to deny that. But there is a developmental section. And remember, when we talk about developmental in psychology, that means kind of like growing up from kid to adulthood to death. The next one we talk about is called family fusion, present or origin. So I just want to explain what fusion means. Um, so you can kind of imagine a sweater. There are different types of sweaters that are knit, right? Some are loose with lots of holes that you can see right through, and some are knitted really, really tight, right? So families could either be very, very tight or very loose, or maybe somewhere in the middle, which is hopefully the best part, right? But there are variations in each family, and so that's what family fusion is talking about. So when people with low levels of differentiation or fusion are particularly reactive to environmental stressors and when under stress are likely to resolve it by, so depending on how close they are or far apart they are, when there is stress that happens in the family, they might withdraw, they might start fighting or conflict, um, dysfunction of one spouse. One member might not necessarily understand what's going on. They might act a little out of the ordinary. Triangulation of a child that results in dysfunction. So that means it's bringing in another person so that that third person will side with one person or the other, right? So that's something that could be difficult as well. Then there is dysfunctional behavioral sequences. So this is the example right here, just this list. One parent is in an intense relationship with a child. The child's symptomatic behavior becomes more extreme. The mother or child calls the father for help. The father steps in to take charge and deal with the kid. The mother reacts against the father, insisting that he is not dealing with the situation properly. The father withdraws to disengage, and then the mother and the child deal with each other again. So you see how dysfunctional that is, the behaviors, right? You ask for help and then you blame them for not knowing what to do. And then so that person's like, well, I was trying to help, never mind then, and then they leave. And then suddenly the problem is still there. Do you see how that's a behavioral issue? Then there are hierarchy problems. Problems can occur when hierarchy is either absent, ambiguous, or culturally inappropriate. Okay, so who's in charge? Who has the most say? Who has the least amount of say? Sometimes some families don't, where the family where it's like, oh yeah, honey, do whatever you want to do. It's okay, whatever, right? Free love and stuff. But sometimes that's not necessarily very good either. Dysfunctional may also be due to coalitions that cut across generational boundaries. So the example would be the father and the child collude, basically get together to avoid what they feel are the mother's overly rigid rules. So the daughter and the father will team up because they don't like what the mom is saying. Instead of communicating with everyone and saying, you know what, we need to let go of some of this stuff or whatever, instead you're going to team up and then go against the mom or something like that. And then there are communication problems, which is kind of self-explanatory. Lack of clarity creates communication problems. So again, you probably hear me saying this all the time. I don't like it when people talk in vague terms, right? So instead of saying, people get me down, you want to respond with, which people get you down and how do they do it? Because you want to see proof. Okay? You want to see the evidence of how people depress you. Is it the way they look at you? Is it the way they talk to you? What is it, right? And I'll give you another example. I always love it when people are clear. I always ask follow-up questions because sometimes people talk in a vague way. Here's an example. If I'm trying to get to know you, I might say, hey, what kind of music do you like to listen to? And if you respond back to me with, I like everything, right? That irritates me, although I won't show it to you, because that doesn't really mean anything. And also, I promise you, I'm going to name someone, and you're going to go, I don't like that. And then I'm like, well, you just said you like everything, right? And then that becomes very frustrating, right? So instead, you want to, from now on, I hope that you guys start to speak more clearly and more specific, in more specific terms, so that you become a better communicator, okay? Avoid, I don't suppose you would like to go to my mother's with me, right? Because that sounds really unsure, right? Let me say it again. I don't suppose you would like to go to my mother's with me. Instead, you might want to say something much more concrete, much more strong and specific, which is, I would like you to go with me to my mother's. Let me say it again. I would like you to go with me to my mother's. So that shows your desire and you're speaking in a clear way. You're not giving them a choice. You're letting them know, this is what I would like for us to do, okay? When communication is not congruent, which basically means nonverbal behavior or vocal tone contradicts the verbal content. So You know, it's like sometimes when people look really sad and then you go, are you okay? And they're like, oh yeah, I'm totally okay. And then you're like, oh, no, you're not, but I'm not going to go further, right? But as a counselor, you will have to go further. But that is also something that you want to notice as well when you're talking to your clients is, does the verbal, what they're saying, match with their nonverbals? Okay.